The cord blood and placenta, the only positive test that came back with that was the Lyme. So all of my other infections that I had either became inactive or eliminated or had still did not get transferred to the blood or the placenta. That was a nice definitive way to see if the Lyme had passed. And then again, like the cord blood, those type of things, babesiosis, protozoas would be in the cord blood, other pathogens that live in different places.
So we plan to test the cord blood after the births. The doctors were really helpful and, happy to do the cord blood test. And they did that, and Otis was born, and he was healthy. He didn't have any sores or anything on him. He was beautiful. We didn't get results back until 2 months later or something. It was a while, kind of a long wait, and it came back negative. So we were like, I thought, yay, he didn't get it from me. We did it. The antibiotics worked.
My biggest dream throughout my entire life has been able to have children. When I found out that I was actually pregnant, it was actually sort of that last sort of hope for us to be able to have a child. We were looking at having to do IVF because of the damage that the Lyme had done. And I was fortunately able to get pregnant, and it is a miracle in and of itself that I was able to. He has a lot of oral dysphagia where he has difficulty swallowing food, a lot of difficulties with textures, smells, tastes, all of that. But it seems that the feeding issues for him, the GI, the sensory processing, and the language are the biggest pieces for him. He's had 5 ultrasounds done, mostly of his head and brain. He's had 2 upper endoscopies with biopsies done on him. He's had 2 EEGs. He's had a sedated brain MRI done. He's had an auditory brainstem response test to check with the hearing. He's had a modified barium swallow study. I mean, this is a kid. He wasn't even 4, and he'd had all these tests done. He was diagnosed with autism spectrum disorder, with the mixed receptive expressive language. And some of the pieces fit, but a lot of the pieces didn't for us. When I got the phone call with the results from the PCP that he was Lyme positive, my whole world shattered. And it happened at a time that I was actually with my own nurse for my own Lyme getting IVIG for my own Lyme stuff. So here I am getting the nose of his Lyme diagnosis as I'm undergoing my own treatment. Despite me doing everything I was supposed to with medications, antibiotics, supplements throughout pregnancy, he still ended up getting sick. And then he ended up testing negative. Tissue samples that were collected tested negative. And so it does leave to a sort of sense of false hope because you think that, okay, he's in the clear, the testing came back negative. When you have a child, you first go to your pediatrician. They're your first one that you see. And training the pediatricians to look at other things, to be aware of Lyme disease, to be aware of congenital Lyme and how it presents, and just have it on their radar. And be willing to have an open mind and be willing to do the testing necessary if that is what is required. And so that if you're looking at a child that you believe has autism, maybe looking at, let's just test you before we do this diagnosis of autism. Let's look at congenital Lyme. Let's run the tests. It's not going to hurt anything, but it may give you some answers that may lead you on a different path and maybe allow that child to get a better outcome.
I have put a lot of thought and time into, theorizing what could be looked at in the future for especially Lyme patients and tick-borne illness patients, and definitely focusing on the congenital side of it, genes, how genes affect this as in transmission. On the parental side, would transmission be higher from if both parents had it, when conception occurs, as well as, being sexually transmitted as well. But there are so many opportunities out there for researchers.